Meanwhile, Israel's Prime Minister Benjamin Netanyahu continues to zero in on military operations in Rafah, where 1.4 million Palestinians are staying as they seek refuge from the war. He says Israel will fight until absolute victory, despite calls from world leaders to avoid a ground operation in Rafah. The Gaza Health Ministry reports more than 28,000 Palestinians have been killed since Israel's response to the October 7th Hamas attacks. Chicago area nonprofit MedGlobal has been on the ground in Gaza, providing medical care and helping with humanitarian efforts. Yesterday, the organization released a statement of warning of potential catastrophic repercussions if steps aren't taken to ease military activities in Rafah. And joining us now is Dr. Zaher Sahloul, president and co-founder of MedGlobal. Dr. Sahloul, thanks for being with us again.
Good morning, Ryan. Thank you for having me.
So as a nonprofit, nonpartisan, apolitical humanitarian organization, why is MedGlobal now making this public statement and plea about the conditions in Gaza, particularly Rafah?
It's a horrible situation. Of course, we are humanitarian organizations. We work in many disaster areas, including Ukraine, south of the border here in the United States with the migrants, Bangladesh, Sudan, Yemen, and Syria. But Gaza is one of the worst humanitarian crises that are witnessing. I've been in Rafah myself for 2 weeks with a group of physicians from MedGlobal. We sent another team, just returned a couple of days ago, and the situation is beyond description. You have 1.5 million people who are cramped in very small area, which is the city of Rafah. When I was there in a small house, there was an open area in the beginning of the mission, and by the end of the mission, it was full of tents. And these are very primitive tents because there's no proper tents even. And in every tent, you have 10 to 20 people. So right now, with this offensive looming on Rafah, you cannot expect 1.5 million people, including many elderly and sick people with disabilities, women and children, to move suddenly to another area in Gaza. It's not easy. You cannot just order a moving company and move 1.5 million people with hospitals, with tents, with supplies, and with food and clean water. It's a terrible situation, and I feel sorry that the Palestinian people have been displaced multiple times. And until they receive what's perceived as safe area in Rafah, and now they have to do it again.
How are you able to help these people administer medical aid under such dire, dangerous, and obviously unsanitary conditions? How are you able to assist them?
We had multiple clinics. We have about 12 clinics in Rafah, my organization, including a clinic that I worked in Rafah itself in an area called Tel Sultan. We were seeing 700, 800 patients every day. Patients with respiratory infections, patients with intestinal infections because of the lack of clean water, patients with hepatitis because of outbreak of hepatitis, malnutrition. We just opened a malnutrition stabilization center for children with severe malnutrition because there is the signs of increasing famine and malnutrition because of lack of nutritious food. There's no aid that entered Gaza in the past few days, including medical supplies and medications, and now you have this offensive on Rafah looming. It's a terrible situation for the people of Gaza and for any international humanitarian organization that are trying to help. What we are asking for is to consider other extreme measures to get aid into the people of Gaza, including airdrops that was used by the Jordanian authorities with success multiple times. And I think our government should be considering airdrops of food and medicine, life-saving medical supplies to the people of Gaza.
So not specifically a ceasefire or a pause in fighting, but just allow the physicians and doctors like yourselves who are there to get the supplies, the critical supplies they need to help those people who are immensely suffering. Dr. Zaher Sahloul,
Ryan, a ceasefire is good. Stopping the attacks on hospitals is good. This is the best thing that can be happening to the region. But also increasing aid is very important.
Understood. We have to leave it there, but as always, we appreciate you joining us, Dr. Sahloul, president and co-founder of MedGlobal. Please stay in touch with us as this situation continues, unfortunately.